We are in a month of October, and you know October is the pink month. Seriously, we are in advocating, talking more about breast cancer. My name is Nana Kojo Boachi Yadom, and in with Dr. Noble. Doctor, hope everything is fine.
Very well.
You are looking splendid.
Thank you.
Seriously, you are.
Thank you.
Nice gentleman. And inside with my lovely sister Belinda. Hope everything is well.
I'm fine, yourself?
I'm good.
I'm great.
I'm good. If this is the first time, please subscribe to KGTV. Then share, press the bell notification so that you get everything that we drop. We are talking about breast cancer. Doc, let me start from you. When we say breast cancer, how are you going to explain it to us?
Thank you very much for the question. Once again, as you said, we are in the breast cancer month, globally known as the pink month, where we have get the opportunity to educate the public on breast cancer. When we talk about breast cancer, it's a type of disease whereby the abnormal cells in the breast grow uncontrollably. They grow to a certain stage that we can't control, and then they form into a tumor. Yes, the tumor can be localized at a portion or spread. When it spreads, it becomes a cancer. But when it's localized in a portion, that's when we have a breast tumor. So you have breast tumor that develops into breast.
Normally, when we talk about breast cancer, everyone get to know that we are talking about women.
Okay.
I want to ask if men also can get breast cancer.
Unfortunately, yes. We the men are also at risk of getting breast cancer.
Okay.
Why not? Why? Because every individual is born with a tissue of a breast tissue. So you and I, even though we are males, we have some breast tissues in our body. So those bodies can also develop into breast cancer.
Okay.
Yes.
What
There is actually about 0.5 to 1% of males that develop breast cancer globally.
Why?
0.5 to 1.
Okay.
Yeah, we are not at high risk.
Okay.
That's why the value is very small.
Okay.
Yes.
Let me ask Sister Belinda. Please, have you ever encountered a lady suffering from breast cancer?
Thank you for the question. Yes, I have once.
Okay.
Yes, I have once. And sometimes it comes with the causes comes with discharges.
Okay.
Yes, it comes with discharges and it goes swollen. The breast will get swollen, reddish, and then you see this white discharges coming from the nipple.
Okay.
If you nipple now, no one say na nipple no, it's your white liver. Remember what you know say be a old breastfeed, and as a me, or you can say, me way now then a discharges neighbor. It can be breast cancer, so you have to quickly go to the hospital to do some checkups to see if everything is okay.
Okay. Let me ask doctor, what are the causes of it? Will I be sleeping, wake up, and it will start developing in my breast or?
Okay. As our car, as compared to our car, which always give us a notice, but sometimes we just ignore these specific signs. Breast cancer, in terms of research, we don't have a specific point or cause that I would say this is the main cause of breast cancer. But there are a variety of risk factors. We place people at high risk and people at low risk. Those people with the high risk can easily develop breast cancer. If I go into the risk factors for breast cancer, for instance, you have come from a family who has suffered breast cancer before.
Okay.
Maybe your mom, your auntie has suffered breast cancer. You are at high risk of developing a breast cancer. If you yourself have suffered breast cancer before, maybe from the left, there is a possibility that you might have a breast cancer of the left breast.
Okay.
Yes, so either a family history, your own personal history of breast cancer, and then some ladies have personal history of breast diseases. Talking about some diseases like lobular carcinoma in situ. It's a mild form of cancer that starts in the female. Whenever any female is diagnosed of this LCIS, you have to quickly take on the possibility of doing another breast examination to rule out a breast cancer. Smoking, alcohol use, and many more, which are also part of the risk factors. We also talk about hormonal imbalance or people who are on hormonal therapy. People who are on hormonal therapies are also at risk of developing breast cancer.
Okay.
I don't know if Ms. Belinda would like to ask something.
Because
we have a lot more.
So we have something like the doc was saying something about our lifestyle. Yeah, so we have something about the genetic. He said earlier about it about the genetic. So it's about if your family have it, they have this. It's two different. When people say their family history and the genetic, it's a little bit confusing because with the genetic, it means it's in the family. So there is a high possibility that you get it. Yes, but with the family history, it's a lifestyle. Like the family, they are smokers. Everyone is smoking in the family. Everyone likes drinking. That's their lifestyle. When you are born into that family and you don't change your lifestyle, and you also decided to go by it and do whatever they are doing in the house there, you also definitely get the breast cancer.
Okay.
But then if it is not your lifestyle, you change your lifestyle, you won't get it.
I've not gotten to know any symptoms. I'm not suffering from breast cancer, but I want to go to the hospital, do some checkups. Do I have to do that, or I should wait before developing it, before I go?
Okay. There is this saying about breast cancer that early detection saves life. We advise that we don't have to wait till we are sick. That's why there are 3 stages of early detection. We have self-awareness. That is yourself, you have to be aware. You have to be inquisitive to go to the hospital, like what you just said. I want to come and check this and that. Then another factor is you doing the self-examination at home, irrespective of you being sick, you seeing anything in your breast. You just take it upon yourself that every month I have to examine my breast. And then the third one is mammogram. So those 3 key points helps us to do what? Get early detection. We can save lives. Because when the cancer is detected very early, the survival rate is relatively 99%. So the earlier we detect it, the easier it will be cured. Yes. So you don't have to wait to be sick to go for breast examination.
You take us through what I need to do that will define me examine myself.
Okay. So you are talking about the self-breast examination. Okay. So when you are examining yourself as the lady, bear in mind males too. Today we are coming out to say that males also are likely to have breast cancer. So the males can also practice this at home. Okay. So the first thing we're looking at is to check, look for a mirror. You have to stand in front of a mirror. You have to see yourself. So you are standing or sitting in front of a mirror to expose your 2 breasts. So you stand, expose the breast, and then you are looking first of all at the shape and the size of your breast. What you can see is the first thing. Has this size become bigger than this one? Last month I realized this place was dark, now it's becoming pink. So you notify a change. Then after that you start going around the breast. There are different forms. Somebody can use the 4 palms, the flat side of your fingers, to go clockwise or anti-clockwise. Some people can go like this or upwards. The most important thing is that you cover the full breast. Yes. So what do? I trying to examine my left breast. I have to use the right hand. So the hand that each hand examines the opposite breast. I can't use my left hand to examine my left breast. I have to use my right hand. Yes. So the right hand with my 4 fingers, the palms on my fingers, I go tap on it, gentle, gentle, all to the way. And don't forget the nipple, because it's also a vital point. When you finish going around, you have to look at the axillary side. That's the armpits, because the lymph nodes from here connects to the breast. So any infection here will affect the lymph node. You might not see anything in the breast, but when you come here, you might palpate the lymph node, which will also be taken seriously. So you go here, you don't raise, most people raise their arms or their hand when they are doing breast examination. When you raise the hand, the armpit is not at its right anatomical position. You have to put it down so that you can fully grasp the armpit and then examine all the lymph nodes one by one until you finish. So roughly within 2 to 3 minutes you should finish the self-breast examination.
Since we have a lady here, yes, I will ask, have you done it before? Have you examined yourself?
Yes.
How was it done?
So as Doc said earlier, that is how you're supposed to do it. So I think Doc has so the examination was quite simple with what Doc did. So the same way Doc did, that's the same way you go as a lady. Yes.
As a wish we say we do on Sat
now as a oh should be it's way more she woman you are safe.
Oh, okay.
But almost a baby can cry, almost say there is some change. So it's good to check it every month.
Oh, okay.
At least every month you have to be doing that all the time. So for you to know that okay there's a little changes or there's some slight changes in it. But if there's no changes in it, voila, we are good to go.
Are you the only person to check it? Oh, okay.
I want to answer what she said. When I was talking about it, I made mention about the nipple. I didn't go into detail.
Yes.
Yeah, she talked about nipple discharge. Yeah, nipple discharge counts, and then usually it's bloody.
Okay.
Usually it's bloody when you are talking about cancer, so we shouldn't forget that. And then also when we do the breast examination, we shouldn't just touch the nipple. We should squeeze the nipple. Don't be afraid of the nipple. Squeeze it.
Okay.
Something will come out. If it comes out, you have to see your doctor. If it doesn't come out, you are safe.
Okay. I want us to go deep into the importance of me examining myself. Do we have some particular importance that when I examine myself, it will be a benefit of me?
Okay. Everybody knows him or herself better or best. You get it? So self-awareness is key. If you know your breast, there is a point that talks about knowing your breast. Your breast. You have to know your breast. That at age 34 or at age 40, my breast was like this, was like that. And then after 3 months, it became very dense. I don't know you to have a less dense breast than I'm seeing now. So if you know yourself, you will know that this month my breast is denser than it was last 3 months. So knowing yourself is very key. So it is important if you have yourself examined, you will point out vital keys even to the doctor. Because you can tell the doctor that I already have an inverted nipple. Because the doctor
know your breast more than
the doctor. So you are at an advantage to yourself and even helping the doctor. We assist the doctor. Because you go to the doctor is seeing your nipple and telling you that, hey, you have a flat nipple, which is a risk factor for breast. You say, oh no, my nipple has been like that. You get, so there are advantages. This is one. Another one has to do with the size. The size of your breast. The doctor might see your breast or your nipple and see that this nipple is very big, extraordinary big. But to you, it's a normal nipple for you. But the doctor has not seen that in a whole lot of people. So you knowing that, you'll be able to tell the doctor that is normal with me. Do you get it? Yes.
Do we have types of breast cancer?
Yes, please. We have types of breast cancer. Breast cancer comes with a location. Yeah, the name of the cancer comes with a location. We have angiosarcoma. I'm going to mention some big things.
Okay.
We have angiosarcoma, which is one. It's a rare type, but it happens in the linings of the breast tissue. And then we have another breast cancer that happens inside the duct, the milk duct, which is a ductus breast cancer, or ductus carcinoma in situ. Then we have lobular carcinoma in situ, which happens in the lobules. And then we have inflammatory breast cancer. We have Paget's disease of the breast. We have a lot more. depending on where the cancer tissue is found.
Okay. My next question is, do we have a cure for cancer?
Science is still working on it. Science is still working on it. But as I said from my earlier presentation, early detection can save life. It can help you, the cancer to be cured.
Okay.
Why? Because maybe we detected it at 0.5 stage, not at stage 3 or stage 4. So that point we can be able to cure it. But when it outgrows out of its local environment, which we call it as metastasized,
okay,
then cure becomes difficult. That is where we go into the modes of management or treatment, but not cure. Yes.
Okay. My next question to Sister Belinda, I want you to use this platform, advise your fellow ladies on how to do things that will not lead them into this.
Okay, thank you so much. My advice to my ladies is stay away from drinking, smoking, and live a lifestyle, a healthy lifestyle for yourself, and do the examination at least every month. Doc have shown us, all of us, how to do the examination, which is quite easier. It's better to do the examination at home, live a good lifestyle, a healthy lifestyle, than to get the disease. Because when you get the disease, to cure it, it's a whole day. It's either the treatment comes with the chemotherapy, which is very expensive, or the surgery, which is also very expensive. And even after the surgery, sometimes it comes back. So it's better we stay away from all those things. We take a good lifestyle, a healthy lifestyle. Yes, stay away from drinking, smoking, live a healthy lifestyle, eat well, and do the examination.
Okay, Doc, if someone is watching us now and the person is suffering from breast cancer, what are the things the person needs to do now? Maybe the person is on medication, but if you have an advice to this person that is watching us now.
Okay, thank you very much. I would advise this person, if he or she is obese, to lose weight, because obesity is one of the key factors of somebody being susceptible to breast cancer. So in as much as you are on treatment, if you are obese, you have to lose weight. You have to carry on with some exercises. Exercise helps. At least 30 minutes a day. Every day. 1 year, 30 minutes. 30 minutes a day. As my sister said, you have to abstain from alcohol and smoking. They will tell you all this before they even put you on the medication. And any change you see in yourself whilst taking the medicine, you have to report back to your doctor. Don't say, oh, doctor said I should take the medicine, so I'm seeing this change, it will go. I'm still taking the medicine. I've not gone back to report to my doctor. No, you have to quickly go back and report to the doctor.
Me do you na madam for me. I say me musa question we. I say a man be say me man esoke no for no a ya eno so timi ma cancer ba.
I think I've read this somewhere, or I've heard some colleagues of mine saying this, just to tease some few guys, you know. Scientifically, we don't have a proof that the more you suckle on the breast, it reduces the risk of breast cancer. But it's there online, in as much as they say if you have, excuse me to say, a lot of multiple sex, you reduce prostate cancer. Yes, so it's there. They will tell you that the urologist said if you have a lot of sex, if you have multiple sex, you reduce the rate of prostate cancer. The same way going around that when you suckle the nipple a lot, you reduce the rate of breast cancer. But when we go into the scientific world, it's not justifiable.
Okay. Family, we are still with Dr. Noble. Doctor, we are going. Your last words to those that are watching.
Thank you, viewers. Thank you so much for watching. It's a good thing to get educated every day. I'm advising each and everyone. Today I have said it, that I am also at risk. You are at risk, being it a female or a male. So let everyone come together and fight this breast cancer. It is an awareness month. So let's go out there, spread the word, and then together we'll achieve our main goal of reducing the breast cancer in Ghana and globally. Thank you.
Any person that you want to greet?
Before I go, I would like to thank all my patients at Edusei Executive Hospital, Community 25, where currently we are ongoing breast screening examination. So shout out to all of them. Those who are coming, keep telling your friends to come and patronize us so that we can have a common goal. Thank you.
My dear, anyone to?
Shout out to all my loved ones, all my friends out there. Shout out to all my women out there. I will encourage everyone to participate in the breast screening. Everywhere you are, just participate. If you can't participate, just do it yourself at home. I will encourage everyone to do that this month. Thank you very much.